Good morning and welcome to episode, oh gosh, I don't even know. I think episode 12 of the New Troop podcast. I am Caitlin. I'm your fearless troop leader. And this podcast is built to help platform people who are like-minded, who are out chasing their dreams, setting the world on fire, and taking us along with them. Today, we have Dr. Stephanie Zwonitzer, who is a doctor of nursing practice and founder of Revive. Revive is something I'm so excited to talk about today. It's an institute of sexual health providing personalized, evidence-based sexual health and hormone optimization care for individuals and couples seeking confidence, connection, and vitality. Also, Dr. Z is the host of the podcast Between the Sheets, which I have been on, where she leads thoughtful, science-backed conversations about intimacy, relationships, hormones, and sexual health, helping normalize topics that are often left unspoken. My most favorite thing about you is that your mission extends beyond treatment, includes education, empowerment, and redefining what it means to feel whole. And let me tell you, I just adore you. I love your content. I think you're an amazing human.
Thank you.
But the fact that you focus on helping people feel whole is
Yes.
so beautiful, is so freaking beautiful. So let's dive in. Welcome to the podcast. I'm so happy that you're here.
Thank you. Yes, me too. I know it's been a while since we've chatted.
I know. I was on the road when we talked last time.
Yes.
I was in Page, Arizona, in
Mhm.
my travel trailer, and I was perched on like this little lip of a a thing in the back seat. It was amazing. So talk
Yeah.
to me about what's going on. What's new in your world?
Yeah, so I left the urology practice that I was a part of. Medicine has taken a lot of changes in since I've started practicing, and unfortunately, one of those changes is that insurance keeps getting bigger and medicine keeps getting more corporate. And so I decided to leave and open my own clinic where I can practice medicine the way that I think it should be practiced.
Yes.
And so I opened Revive, Institute of Sexual Health. I'm very excited about it. And we help all throughout the sexual wellness spectrum. But a lot of it revolves around hormone therapy for men and for women because our hormones affect our sex drive and how lubricated we are and all the things.
Yeah.
And so that's a big part of it. And then also just working through any sexual issues that you might be having, preventing you from having like your best sex ever. And it's so much fun. I get to be involved in an area of life that most people don't talk to other people about. Maybe their closest friends, some of them can't even voice their concerns to their own partner, but they'll come and talk to me. And so it's really an amazing area of someone's life to be a part of and help them feel whole again. You don't feel whole if you can't, show love in this physical way. And I think it's been really impactful for me as a provider and for my patients.
Absolutely. And I can only imagine. So I don't know if you know my journey or my story, but I've been on this path for almost 8 years. I have wanted a
Yeah.
hysterectomy for a lot of that time. My hormones are all over the place. I was just recently diagnosed with stage 4 endometriosis. And now I have to have a major
Mm.
surgery. If at any
Oof.
point in my journey I had stumbled across someone like you who actually listened and cared and wanted people to feel their best, I think my journey would have been a little different. I really would
Yeah.
have. So how do people get into your ecosphere? Like, how are they
Yeah.
finding you? Is this something that's like a referral? Obviously, it's hard because you don't take insurance, and it's not like when we
Right.
look for doctors, we're like, we go onto our insurance portal. So how are people
Mhm.
finding you?
Yeah, it's a great question. So some of it is from my podcast. I have listeners there. I've been doing that for almost 2 years now. Some of it is silly social media videos that we all have to make to
True.
be out in public now and get some attention, right? And a lot of it is word of mouth referrals. I've been in my community for quite a while now, making an impact. And fortunately, my patients like me and my style. And
Yeah.
so, I have some good Google reviews out there. And so people find me that way. My website is reviveish.com. So a lot of people will come in that way. There's a contact form on there that you can fill out. So that's really helpful. But yeah, we don't take insurance. So
Yeah.
if you go on your insurance platform and look for a hormone specialist, you're not going to see my name listed. But there's a reason for that. Insurance limits how much time I can spend with you, what medications I can prescribe, how often. All of these things are dictated, even lab tests, like what
Literally.
labs I can order for you. It's
Isn't that
insane.
so
Or how,
weird? That is so weird
Yes.
to me. Like
Yeah.
when I did my first hormone panel, I was with my endocrinologist because I don't have a thyroid.
Mhm.
And I had to beg, borrow, and steal this man's time and attention to get me to order a freaking hormone panel. And he goes, none of this is gonna be covered. And I was like, and I'm asking you to write just the order to get the blood
Right.
work. Took 13 vials of blood. I'm not kidding you. He forgot why I was back to see him again. He walks in and he goes, hey, I just saw you a couple weeks ago. Why you back? I said the 13 vials of blood that you ordered to talk about my hormones. He didn't
Yeah.
even have the results. He goes out, hey girls, talking to us, hey girls, do you have her paperwork by chance? I'm like, I have it print, I have a whole binder. I have it printed out
Yeah.
right here. Do you want it? And he like bloop, 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 flipped through. About 2 minutes later, he's like, yeah, everything looks good.
Mm.
I was like, oh my God, what are we talking about? And the fact
Yeah.
that most of your appointments are telehealth, correct?
Yeah.
Like you
Yep.
are access 101. You are what
Yes.
we are looking for. I love it so much because like busy people, especially women, we're busy. We're running
Yeah.
homes, we're running jobs, we're running companies. If you're a mom, you're taking care
Mhm.
of people. We don't have time to drive 45 minutes to an office to wait in the frickin' waiting room for 35 minutes to talk to you for 10. That's what
Right.
happens. Like you
It
have
is.
opened the door to access for people that don't have access normally.
Yeah.
That's freaking beautiful.
Thank you. Yeah, it's what I want. I mean, so I'm currently licensed in the state of Maryland, so I
Yeah.
see that. I am working on getting licenses in other states, but there are rural areas of Maryland. There are suburban areas. Like where I worked in the urology office was a very urban area, but I would have patients that lived 10 miles from our office and it would take them 35 minutes to get here because of traffic.
Wow.
So it's a huge barrier. And so there's like two sides of the coin, right? Sometimes when you're talking about really intimate issues, you want the comfort of being in your own home. You can wrap up in your blanket, you can have that security or whatever, right? The privacy.
Yes.
There's and so that gives you that with the telehealth. Some people really like being in person for that because they want that in-person connection. And so I don't know, maybe someday I will have a brick and mortar for people that need that little bit more touchy-feely, but I have found that the majority of people are like what you're saying. I barely have time to get through my day. The last thing I have time for on this topic that I really don't want to talk about anyway is to build 3 hours into my day for it.
Correct. Correct. We
Yeah,
just don't have time. And so it goes on to the back burner and we
right.
spend years miserable, whether it's low
Yep.
sex drive, you're having hormonal issues, you're having
Hmm.
crazy hot flashes. And like, I know personally, I'm not in menopause. They figured
Yeah.
that out, but all of my signs and symptoms are because I have endometriosis. I have stage 4 endometriosis, what has now
Right.
infiltrated my fucking appendix, which has to be removed. And I have to have a possible bowel reconstruction and
Oh
I have
my
to have a full
gosh.
hysterectomy. It took 8 motherfucking years to get here, friend.
Yeah.
8. And you know what the weirdest part was? It took finally getting to a doctor who sat down like you did, who
Mhm.
I have a whole binder. I've seen every specialist. At one point, people were massaging my molars. I'm not kidding. Like we tried everything. And
Yeah.
this doctor actually sat down and like listened and went, hey, let's
Mhm.
like dissect what's actually going on. It took that. And honestly, it was also somebody that didn't take insurance. Like, how weird is that? Right?
Yeah.
Like you paid for their time. It was like an hour and
Hmm.
15-minute appointment. They looked through all of my paperwork. And I just don't think we talk enough about that. Like, yes, there
Yeah.
are people out here who don't take insurance, but they are probably 100 times better than who you're seeing now and worth
Hmm.
every single penny and dollar.
Yeah.
Ugh.
And you're right. And here's the thing that because I will have even some of my closest friends that say, "Yeah, I'm not going to come to you because I can go get this through my insurance." So there's a
Ugh.
couple arguments that I have for that. Number one is, what did you spend out this weekend? Because
Mm,
you probably spent more this weekend out on dinners and drinking and things that aren't good for you anyways.
right.
That if you just skipped 2 nights out a month, you'd be able to afford me. You'd be able to, and it's not afford me, it's afford your own healthcare and your future. If you are willing to invest $75 going out to dinner tonight and
Mhm.
eating food that's fried and God knows what and has how many other preservatives and is wrecking your health, how much more then should you be willing to spend that same $75 on fixing your health and giving yourself that longevity and vitality? It's to me, it's a no-brainer. I have had insurance for years and years, and my primary care doesn't accept my insurance that I have. I go pay out of pocket anyways because I like her as a physician.
Yep.
I want to go see her. She respects me as an NP. We have really good conversations about where I'm at health-wise and things like that. So I will pay out of pocket for that. I will
Yes.
pay out of pocket for the functional medicine doctor who's going to look at the outside the box labs, and I will pay for someone like myself who's going to look at the whole picture of
Right.
your hormones and not just one number here or there. And I actually know if you still get your cycle, what days of the month we want to check those for. A lot of
Right.
times you're just like, here's your lab slip, go get your labs done.
And then you like don't take into account anything about your cycle, anytime
Yep.
in the cycle that you're in. And like there are red flags throughout your cycle, right?
Yeah.
And oftentimes you need to take blood work in that phase.
Yep.
And people don't talk about that. They're like, oh, your
Right.
labs are fine. No, they're
Yeah.
not. I promise they're not. Like, I don't feel well. I need help.
Yes.
Oh, I love that you're
And I
doing that.
think I think that right there, what you just said is, I don't feel well and I need help. That is the number one reason to go get checked out.
Yes.
If you don't feel yourself, nothing else has changed, right? We're not talking about you just had a baby, you just lost your job, moved
Yeah.
across the country, changed all your friends. We're not talking about major life events. Every other thing in your life is pretty stable,
Yeah.
and you just don't feel like yourself anymore. You can't keep up with the kids anymore. You're falling behind at work. You're not finding your words. You're just not you anymore.
Right.
Something is going on, and you need to find one of us to help us. We'll figure it out. We will
Yes.
sit there and we will work through the puzzle with you.
Isn't that so
Yeah.
crazy? And also, I
Yeah.
think people don't realize that as long as you have the blood work paperwork, you can go pretty much to any lab that you want to pay out of
Yeah.
pocket for. And like
Yeah.
we have a lab here in Raleigh that I love that I can just like if I need to double check things, I can just go and pay for whatever
Hmm.
panel that they have just to double check it against what I'm currently looking
Yeah.
at, right? Like, okay, yeah, LabCorp is cool, but it's just so nice to have like a double. This is what's going on in your body,
Right.
right? And I
Right.
didn't realize that until I started down this rabbit hole 8 years ago. I didn't even realize that there was people out here that did this kind of
Hmm.
stuff, right? So I think that's the point of like platforming individuals like yourself is
Yeah.
because we operate in these like silos of I'm the only person on the planet that feels like this and nobody cares.
Hmm.
Nobody wants to hear about it. Nobody wants to treat me. I don't understand where to start. I don't even know where to look, right? And so it's hard to even get out of that like lonely bubble to go, are there other
Hmm.
people that are dealing with this? And the answer is
Yeah.
yes. The answer
Hmm.
is yes, both male and female.
Yeah, absolutely. And the one thing that I would say as a caution is make sure you're finding a provider that's worth their shit.
Mm,
There are a lot of clinics that are started as a Botox clinic, and now it's like, oh, well, perimenopause and menopause are having their moment. Let me just offer this.
ooh,
Double check that they actually went and got good training and have the certification to back their name, because hormones are not something that you can go take a 2-hour course and be able to do well.
right.
You have to learn that hormones all interact. And if you're only looking at estrogen, progesterone, and testosterone, you're missing a huge part of the ballpark.
Yes.
And so there's just, I'm not saying that it's wrong to have a clinic that does aesthetics and wellness. There are some really fabulous ones. I have friends who have fabulous clinics.
Yeah.
But make sure if it is a clinic that has always just done this one thing, and now they're also offering GLPs because that's a fad, and they're also offering hormones because that's a hot topic right now, just be careful and check their credentials. That's all.
Yeah.
Because there are a lot of people who just don't know, and they're going to start guessing because it's quote unquote fancy right now. It's
Yeah.
popular.
Ooh.
Yeah.
That's like gas station sushi. It's
Yeah.
like, okay,
Yeah.
you can walk in and get it, but is it good? Is it going to give you
Right.
food poisoning? Like,
Right.
are they listening to your problems? Are you gonna have
Right.
explosive diarrhea on the side of the highway? Like, yeah,
Yeah.
okay, you
Yeah.
could do it, but it's not a
Yeah.
one-stop shop. Like, this is very specialized. And what I keep hearing over and over is how little general doctors
Mhm.
have in regards to education about hormones, about female health, about our reproductive system, about how
Mhm.
it directly impacts our day to day, and how short of a time it is in their education that they talk about
Yeah.
this stuff. Right. And
Yeah.
so, yes, you can go to your general doctor. That's a good place to start if you have nowhere else to
Mhm.
start. And then start getting curious about like, are there other people out here that can help me with
Mhm.
this kind of stuff? Um,
Yeah.
so talk to me about like your sexuality, your sexual
Mhm.
health in
Mhm.
regards to when your hormones are out of whack, how does it feel? Like
Mhm.
low libido, how is it all
Mhm.
intertwined? Are you okay talking about that?
Yeah, absolutely. Absolutely. So it is all intertwined. So you have components, neurotransmitters in your brain that help you with arousal and desire and motivation. And guess what? It's not just testosterone that gives us our sex drive. Estrogen is a huge component of that. So is whether or not you have high cortisol or low cortisol, how
Mm.
your pituitary gland is functioning. All of these things go into whether or not you even want to have sex. And then we get into the physiological changes when you have hormone imbalances. So, for example, for men, you have men and women that listen to this?
I do. Yeah.
Okay,
Yep.
so for our men, you might have you're just not getting your good workouts anymore. You're just not strong. You're not gaining muscle,
Yeah.
or you're not losing the belly fat anymore. You're having erection issues when you never used to have erection issues.
Oh,
Your wife, all of a sudden, who has never wanted it more than you, all of a sudden is wanting it more than you. Now, there could be other reasons for that for her on her hormonal side
yeah.
too, but if it's and sometimes partners are different, right? The woman just always has a higher libido. But I'm talking about if you've always had the higher libido as a man and all of a sudden yours is less than your partner's.
Oh,
Um, and that could be male part, however your partnership is. So those kinds of things really start to notice, and they just don't have the ability to function at the highest level that they're used to functioning at.
right.
And so that's really where you see the male changes. When you're having those kinds of changes, you need to get your testosterone and your estrogen checked. Check your prolactin to make sure your pituitary gland is sending the right signals. Those kinds of things. For women, sexually speaking, yes, your desire can change, but it's more like your arousal changes.
Oh,
So, whereas a certain type of touch or kissing or something like that may have like boom started the fires for you before, now you need a lot more or a lot slower or completely different styles of getting turned on than you used to.
right.
That can be hormonal. Um, all of a sudden, you're not lubricating as well, you're not as wet,
Mm.
and it's consistent, right? We all have days where we're dehydrated or whatever, but consistently you're not getting the lubrication that you want. Feeling like shards of glass are inside of you while you're being penetrated,
Oh,
that can be because of your low hormones.
wow.
There are so many hormone receptors, both estrogen and testosterone receptors in our perineal area, that as our hormones start changing, we feel physical effects in that area. I will have women come in who have always been in control of their urine, have great voiding habits, and in their early 40s, all of a sudden they're having leaking that they've never had before. They're having frequency and urgency they've never had before. And again, nothing else has changed. Well, guess what? Your bladder and your urethra have estrogen receptors in them.
Wow.
And as you lose your estrogen, you start having more symptoms. So it's not even just the sex symptoms that can show you where you're having lower or changes in your hormones.
Yeah.
And for people and women in the perimenopause phase, you'll have 1 month where you feel fabulous because your hormones are fine that month. And then the
Right.
next month, you're anxious, you don't want anyone to touch you, you don't want to get out of bed, you have no motivation. And then the next month, you're like in the mediocre range. And then the next month, you're great again. Because during those up to 10 years of perimenopause, it's a fluctuation. And whereas we normally in our cycle post puberty, because there's tons of fluctuations in there too,
Sure.
you get this just rhythm.
Mm,
And when you're in perimenopause, it fluctuates. When you're postmenopause, you're just kind of numbed out
right.
as far as your hormones, unless, of course, you're on hormone therapy. So,
Right.
this perimenopause is so confusing because 1 month you're fine. The next month you're an anxious bitch. The
Yeah.
next month you're bleeding an extra 4 days. Like, so it's
Yeah.
so varied. And that's what makes hormone replacement therapy difficult because you've been great for 6 months on the regimen we have you on, and you have one bad month. I'm not necessarily going to make changes for you in that one bad month.
No.
Let's see what next month comes, and if you're
Right.
still off, then maybe we'll make some changes. But you have to kind of go with the ebbs and flows a little bit because it's so drastic from 1 month to the next.
That is so crazy. And why that isn't like dinner table talk? Like
Right.
this is what the majority of us go through at some
Yep.
point or another. Right? I'll be 38 in July, and I I'll be really honest, it wasn't until I was about 30 till I realized that like, wow, that actually directly impacts how I work out, how I
Mhm.
feel, how I'm prone to injury. Like I was an athlete my whole life. I played basketball through college and I was always hurt. Couldn't figure out why. It was really synced up, which I didn't realize at the time, with like my hormonal imbalances.
Mhm.
Uh, Oftentimes I was hurt more frequently, either in or on around my period, right?
Mhm.
And so it's just like, why are we not talking about this kind of stuff? Why is this taboo? Not only for young girls, right? That like
Mhm.
there are different times where training your body
Yeah.
is harder, is
Mhm.
more prone to injury, is you're more likely to gain muscle within this amount of time. You actually need to be doing slower movement, lower impact stuff this times of the month.
Yeah.
Why the fuck are we not talking about it?
Right.
Right. And I think it's because people just don't know. It's not enough. It's not studied enough. We don't have enough
Yeah.
education around it. There's not enough people like you in the world who want to talk about it, who are not uncomfortable talking about it.
Mhm.
Right. And so I think it is really important to have these conversations and just know
Mhm.
that, like, what you're going through probably, it feels very weird for you, but it probably is not abnormal. There's probably other
Correct.
people in the world that are also walking this path, but it feels like such a silo. You just feel like, oh my God, what is my body doing? All of a sudden, I can't hold my pee. I'm incontinent. Oh my God, I have no libido. Oh my God, why can I not get wet? Why is my
Mhm.
hair falling out in clumps?
Yep.
And when I shower, I'm putting all this hair on the wall. Like
Yeah.
that is all hormonal stuff,
Yeah.
right? And
Yep.
especially like the urinary incontinence, slippery slope into the world of like hormones. When you
Yeah.
really start to delve into it, it's like, why am I incontinent? Let me go see a pelvic floor specialist. The pelvic floor specialist is like, hey, have you tested your hormones? The hormone people are like, yeah, you're totally out of whack. What's going on here? Like, you're like, what did I just land in? This is so cool.
Yes.
Like, it's
I
amazing.
love that you just said pelvic floor specialists too, because they are my favorite people. Pelvic floor
Yes.
physical therapists are the most knowledgeable, wonderful people.
Wonderful
They
people.
are so good at
Yes.
being in that intimate area and helping you feel comfortable and developing great tips, tricks, and exercises to help you live your best life. I refer to pelvic floor PTs all the time. I
Yes.
get tips and tricks from them to give to my patients in the interim of getting in to see them.
Yes.
I cannot say enough good things about pelvic floor PT.
I literally can't either. And it's so I didn't go for a long time because I just was like, I've never had a baby. I've
Yeah.
always only ever been told that pelvic floor specialists are people that help
Mhm.
people, humans who have had babies. And how fucking wrong was I? They help individuals with male genitalia. They help
Yep.
individuals that have not had children. They help individuals
Mhm.
that don't even have a uterus anymore. They help
Yep.
anybody. And like our pelvic floor, which I also didn't know, tangent, it starts from the top of the bottom of your rib cage, which is the top of your
Mhm.
abdominal wall, and it goes all the way to your booty hole, your chocolate starfish. That's
Yep.
your whole pelvic floor is like the interior workings of your body. It's what keeps you upright. Like
Yeah.
it's like a very pivotal part of your body. And I just didn't know. And like when I got
Yeah.
there, the first 2 weeks that I saw her, um, her name was Grace. She was amazing. But she was like working up in my rib cage all the way down through my low back, into my hips, down into my like groin area, all the way down to my knee. And I was like, what are we doing? I
Yeah.
thought this was I thought I was here to help with incontinence. And she's like, oh no, like it's all connected.
Yeah.
I was like,
Yeah.
what? And she
Yeah.
was the one who encouraged me to go get my hormones checked. Like they're
Mhm.
wonderful. And I think
Yeah.
what a lot of people don't understand is humans who have male genitalia, a lot of times erectile dysfunction is both hormonal and it's a
Mhm.
pelvic floor issue. And
Yes.
it is sometimes treatable through
Yep.
those two venues. And like we don't
Mhm.
talk enough about that. So talk to me about like ED men. Do you feel like there's a stigma around it for them? Talk to me about that.
Course I do. And there's a stigma around size, which there shouldn't be too, right? I
Yeah.
mean, I had this 26 years old African
Mm,
American male came in with a completely average size penis,
yeah.
perfectly beautiful penis, and he was terrified, still was a virgin because the stereotype of Black men having large penises, and
Oh,
he had an average on smaller than average kind of, but perfectly fine,
yeah.
no problems whatsoever, can get erections, no ED. And I just thought, how awful of a society are we that
Yes.
this poor guy doesn't even want to go have sex? He was heterosexual, so just doesn't even want to go have sex with a woman because he is afraid he's going to be made fun of because he is a race that is stereotypically told there should have big penises. I felt
Oh,
so bad for him. That was
yep.
awful. So, yeah, there's tons of stigmas around whether or not your penis works, what the size is, all the things. Um, for erectile dysfunction, one of the first things I will say is it can very much be psychological.
Hmm.
So anybody like that kid, like he just psychologically didn't even want to perform because he was so worried about his size. If you've had a partner who is like, you don't stay hard long enough, you come too quickly, you take too long to come, you do all these, then you start to develop those. If you had difficulty with an erection last time because, I don't know, you were too hot, you were too tired, whatever, now you're in your head about your head and not getting erect this time. And so psychologically, there can be a lot of components. And so I try to talk to guys about, like working through that,
Hmm.
the head to head connection is very strong. So really try to get those thoughts out of your brain, masturbate, prove to yourself that you can have an erection. It can last until you climax, that way you have better confidence going into a
Mm,
partnered situation. And if you do have erection issues, the first thing I want you to do is have a cardiovascular workup
mm.
because the penis is the smallest arteries in our body. They are the first ones to have plaque changes, cardiovascular changes, and they can be a precursor to a heart attack by about 10 years.
Shut up.
Yep.
Shut up. No
Yep.
way. That is
Yeah.
crazy. What?
Yep. So your penis health is a direct show of your overall cardiovascular health in your body.
That is such cool information. Oh, friend, I
Yeah.
love that. Okay, that
Yes.
makes a lot of sense because
Mhm.
that makes a lot of sense.
Yeah.
Wow.
They need blood to get to their penis to have an erection. And if
Correct.
the blood can't get there or can't stay there, then you can't continue with having erections. Now, as far as what we can do about it, so my favorite thing is if you're having very early ED, yes, go get checked out. But specifically for your ED, get a good quality penis pump. You can get them off Amazon, adamandeve.com, whatever sex store online that you like, go to one in person. Find one in the middle price range. The cheapest one is going to break the second time you use it. The most expensive one is probably way more than you need. Somewhere around $100 to $200 is generally a good price range for a decent penis pump.
Yeah.
You want to use it like pelvic floor physical therapy 3 times a week at the minimum, 10 minutes at a time. You are not going for an orgasm during this event. You're thinking of it like physical therapy. You are exercising your penis. You're
Yeah.
going to do this multiple times a week. And they really show over a 12-week period that you can have better quality erections. Now, I am not talking about increasing length. I am not talking about increasing girth. You're going to hear stories out there that say that they do that
Mm,
negligible amount. Okay. I'm not trying to tell you that you're going to just all of a sudden be Hong Kong,
right.
but you can get better, longer lasting erections with doing some PT for your penis.
Wow.
If you are at the point where we need some Viagra and Cialis, come see me. I'll get you hooked up. I have no problems with that, and you should not feel ashamed that that's what you need. It takes a little bit more planning for sexual activity then when you need something like that, but it's doable.
Yeah.
Um, for patients who cannot take the ED medications for a variety of reasons, we do have injections that we can teach you how to give, which I know sounds super scary. Who wants to give a needle in their penis? But it is a very small needle
Okay.
and it works very well. It's a very local acting medication that just sends signals to your body to send blood to your penis. So that can work really well once you're a little bit more advanced. Or like for my guys who have had their prostate removed, sometimes it's difficult if there was any nerve damage during those surgeries to
Yes.
get full function back. And so the injections work really well for them. There are implants that we can put inside of you if you just have gone through everything and your penis is just shot. We can put an implant inside of you and you pump it up like those old Reebok shoes and get yourself an erection when you want one.
What? That's so
Yeah.
cool. I did not know that. I didn't know about the
Yeah.
pump thing. Wow, that's impressive. And there's so
Mhm.
much, there's also just so much more study about the male genitalia, unfortunately, right? Like
Yes.
there's just so much
Mhm.
more. Okay, so
Yeah.
we've talked about the male side of it. What if women are having a hard time climaxing? What if women are having a
Mm.
hard time? What are some like things that they can ask about? Are there hormones? Is there localized hormones? Is there creams? Like, talk to us about the human side of it that has a vulva and a vagina.
Yep, absolutely. So if it's desire related, you just don't ever care to have sex.
Yeah.
There are two medicines on the market that actually work on the brain component of it. So one is called Addie. The little pink pill is what it was dubbed as because it was the first female one to ever come out. You know, they have the little blue pill
Yeah, the little
Viagra.
blue pill,
So,
little pink pill. Okay,
yep.
cool.
So Addie is really great at working on the brain. And then there's I think it's Vyleesi. I don't use that. I haven't used that one as much, so I don't remember it off the top of my head. But it's
Sure.
close to that. It starts with a V for sure,
Yeah, yeah.
and it also works on the brain component. So those are good if you just like your hormones are fine, but you just don't care about sex. Those are good options.
Stunning.
If it's the physical, I'm not getting wet enough, I'm not getting aroused, things like that. There are a couple different things. So sometimes on the psychological side, most women are what we call responsive desire. Something has to happen for us to want to have sex.
Okay.
And so it's not just walking down the street and, the wind blows and we get a boner like, 20-year-old men do.
Right.
We generally, about 80% of us, have responsive desire. So you have to do something to me. I have to read something. I have to see and watch something that connects with me to get me on this arousal pathway.
Oh,
So for some women, that's listening to erotica, that is reading erotica, things like that, that will actually get them in the mood so that when their partner is around or they want to masturbate themselves, they can do those things and start to be aroused. Works great. That's why we have so many wonderful romance novels.
yeah.
Fabio it can be on my book cover and can tell me all the dirty things and
Yeah.
then get me turned on so that I want it in real life,
Yeah.
whatever.
Absolutely.
So
Love,
there's
I
some
love
things like
spicy,
that.
spicy
Yeah,
novels. That's my fave.
spicy novels are great. They can, go to a boudoir photo shoot and feel really sexy about themselves, right?
Yes. I love that.
Um, yes. But so if you're having lubrication issues, getting turned on issues, there's a couple different creams, like you mentioned creams. So if your hormones are not optimal, so they may even be considered you're normal, okay, but they're not optimal, you're not feeling yourself, you're not getting turned on. We can give you testosterone cream that you can rub right on the vulvas, which can then increase your ability to get the blood flow going in there, get that kind of androgen side of things. We can also give estrogen straight to the vagina, which helps with lubrication and pain and the elasticity of the tissue, right?
Okay.
When we start to get aroused, we are not elongated and stretched out enough to take an item of penetration.
Okay.
We need that time of getting turned on and aroused, and we need our tissue to be elastic to
Oh,
get that. So just like men have erectile tissue to get their penis erect, we have erectile tissue. It's in our clitoris and it's in our vagina so that we can get that elongation to take penetration.
how is this the first time I've ever fucking heard of this? What? Are you for
Yes.
real? You're for real.
Yes.
Why? What?
Yeah.
Okay. I'm fascinated right now. So
Yep.
when a woman gets a human with a vagina gets
Yep.
aroused, the elasticity makes it more what like you can
Longer.
longer? Is that the right?
Longer and a little bit wider. Yep.
What?
Yep.
I'll be
So like
damned.
when you're first getting aroused, if somebody just goes right
Yes.
in there, it
It hurts
probably
like
feels
hell.
uncomfortable and
Yeah,
right. But if you start warming it up with a finger or a toy or whatever you want to warm it up
sure.
with, and then they insert, it's a lot more comfortable. It's a lot easier to take because the elasticity has worked in your erectile tissue.
I always just thought it was lubrication. I always thought the problem was lubrication. It's not. It's
It's
fucking
not.
elasticity. So
Yeah.
that's why as you get older and your elasticity starts to deteriorate because you're in
Yep.
menopause, less hormones, less direct access, right?
Yep.
It is harder. It just doesn't feel as great to have sex, which I think is
Yep.
bullshit. Like, what the fuck? We've got stuff on the market for men to have sex until they're 90, right? Like,
Right.
what the
Right.
hell? So, this is
Yeah.
really great information to have. Thank you so much for sharing that because I
Yeah.
always thought it was just the lubrication. I never ever thought about elasticity.
Yeah. Yep. And
Mm,
so that's why a lot of us, even if you are on systemic hormones where you're
sure.
using an estrogen patch or an estrogen pellet injection, whatever, we will still prescribe you vaginal estrogen because you need it to work locally.
Wow.
So it's really imperative. So, but like back to the arousal part. So this is my favorite thing to talk about is the clitoris, right? Gynecologists aren't even taught about the clitoris. Did you know this?
No, I did not.
because the clitoris is the only organ in the entire human body, male or female, that its only purpose is pleasure.
And
So
nobody can
why would we
find it.
study that? Why would we teach it in med school?
You wouldn't. Yeah.
You wouldn't, because who cares about pleasure?
No
How
one,
dare you want that in your life?
especially female pleasure, especially humans with a clitoris
Correct.
pleasure.
Right. Exactly. Exactly. So, yeah, so they're not like gynecologists are amazing when it comes to helping you birth your baby, helping you with reproductive changes and issues and things like that, reproductive cancers. They're fabulous with it. But when it comes to sexual medicine, if they haven't also sought out sexual medicine education,
Wow.
they don't, it's not their wheelhouse.
Yeah.
Just in urology, it's not even everyone's wheelhouse. I went and got sexual medicine training. I worked with a couple docs that were really great in sexual medicine, and I loved it because I would help them with their surgeries and their patients and things. And I was like, this is what my heart desires. As
Yes.
my son likes to tell me, Mom, does your heart desire that? Yes, my heart desires helping people with sexual health. So I
Good.
went and I got that extra training because it's not part of our curriculum.
Right.
And so it's really important to find somebody who understands that and understands that women need about 14 to 21 minutes for full arousal. Okay. Men will orgasm on average in 5 to 7 minutes.
Oh, wow. So we're not even warm. And they're like, okay, we're done. Thanks so much.
Correct.
Oh,
Yes.
gosh.
So that whole foreplay thing is not really just a precursor to the main event. For women, that is the main event.
Yeah.
Most women don't orgasm with penetration. They need oral sex, fingers, some type of toy or vibrating stimulation. And most of the time, we need it externally where the majority of our clitoris is.
Yes. The
Yes.
fucking external clitoris. I don't know. Something just came across my feed the other day. The first ever 3D rendering of
Yeah.
the clitoral system and how
It's
motherfucking big
huge.
that thing is.
Yeah.
It's not just a little tiny bead. How can you
No.
not find an organ the size of your heart? Like, come on. And it's
Yeah.
external, it's internal. There's
Yep.
all sorts
It's
of
got
bits to
wings.
it's got wings, it's got a bat hood, like a little beak thing. Like, what are we talking
Yeah.
about? That's
Yeah.
crazy. Oh my
Yeah.
gosh.
And for some women, we can even use just a little tiny bit of testosterone right on their clitoris. Now, you have to be careful because you can get clitoral enlargement. So we want to use it sparingly, but Friday night is date night. We're having sex. I always recommend having sex before dinner because none of us feel
Always.
sexy after dinner.
Yo,
Always.
I've never heard anybody else voice this. I am a
Yeah.
sex before dinner girly. I do not want
Yes.
to fucking be full and then try and be sexy. I also have like
Correct.
incontinence issues. So, like, the whole eating and then trying to
Yeah.
feel sexy thing is a bit of a nightmare
Yeah.
for me. Always, you get ready, you look
Always.
cute, you look super hot, you have a little sip of something before you go, you get fun and funky, and then you go out and you have your beautiful night, you eat your dinner, and then you got the itis and you come home and you go to bed. It's the dream night, but I've never heard anybody else say it. So
Yeah.
thank you for being a
Yes.
McClure. Pre
Absolutely. I tell
dinner
people
sex.
all the time. And it works really well for guys with erectile dysfunction because you can take your Viagra or your Cialis while you're getting ready.
Yes.
It kicks in. Viagra has to be taken on an empty stomach to work, so you can't take it after you just went out to dinner anyway. Wait for it to kick in while you guys are getting all beautiful. Have your fun moment and then go have dinner. My fiance and I have a rule. If it is Mexican night, there is either no sex or sex before Mexican night because we are not doing stuff after Mexican.
Absolutely the fuck not. We are not doing that. We are not doing that. Italian, same thing. We're not doing it
Yeah,
after Italian.
no,
I'm gonna be fettuccinoed out. I'm all
that's right.
I also don't
I
want
will
your
be
noodle
passed
after
out
I
from my
just
carbs.
noodles. Like I'm all the way good. Oh man. Yes. Couldn't
Yeah,
agree more. Couldn't agree
yeah,
more. Oh, this is
yeah.
fascinating, friend. I'm learning so much. Um,
I love talking
so
to you.
you're the best. So do I. Adore you. Okay, so when women specifically, humans who have female bits,
Yep.
come in and see you, is there a common theme that people are seeing over and over, or is it all over? Because I want to know, like, the thing that triggered for me was when I started this journey 8 years ago at 30
Mhm,
and started hearing women who were older than me talk about things like incontinence
mhm.
and the crazy hot flashes and pain with sex. I was like, wait, I have all of those things and I'm 30 and I never had children. But they were red flags for me to be like, if they still have it at 45, late
Yeah.
40s, early 50s. They've already gone through menopause. I'm having them now. I should probably start talking about this with somebody, right? So, what are
Yeah.
some things that are like the common reoccurrences that you hear often, or if it's all over the map, just some like general things that people
Yeah.
need to start like paying
The
attention to? Does that make sense?
Yep. The number one thing is just not feeling yourself anymore, and you
Yeah.
can't quite put your finger on it.
Okay.
If you haven't come to me until you're having hot flashes, night sweats, and you can't sleep anymore, you missed the, like, not that you missed the boat, we'll still treat you and get you feeling better. But there are so many symptoms before that. Hot flashes are pretty late, actually, when your estrogen is really tanking that you start to have those. So if you are not keeping up with your daily life, you just all of a sudden you need naps, you don't care about the laundry being folded the same day it comes out anymore. There's
Okay.
dishes in the sink and you've never been a person who let dishes be in the sink before. You all of a sudden have difficulty falling asleep or staying asleep that you've never had sleep issues before.
Wow.
Sex just doesn't feel the same. You don't really care about it as much anymore.
Yeah.
You're needing lube more often than you ever used to need it. Any of those kinds of things, you're forgetting words. You always meet your deadline at work and you just like didn't this time,
Oh,
or something like
yeah.
those
The
kinds of
brain fog.
things can,
Yeah.
yeah, brain fog and just decreased motivation.
Mhm.
Those are when you really want to start getting checked out. Even if you come and like literally we look at everything and we're like, I mean, maybe your vitamin D is low. Here's some vitamin D. Everything else really looks still optimal. Maybe we can tweak a couple of your lifestyle things like not drinking as much alcohol because that can affect things. Maybe your B12 is low and we can get that up a little bit.
Yeah.
But you don't even necessarily need hormones. Well, now we have baseline, right? We know where you're starting when you're feeling not great. So as we continue to watch you, then we can be like, oh, trigger, right now you're starting to go off. Let's get you on board here before you get worse.
Got it.
I think it's really important to get on hormone therapy before you actually think that you need it.
Yes. And I don't think we talk enough about that. Like,
Yeah.
I was just in Bali for a retreat, and one of our hosts was talking about topical estrogen
Mhm.
inside the vagina,
Yep.
lips, vagina area,
Yep.
and how it changed like her whole life, how it was
Mhm.
so transformative for how she was feeling,
Yep.
how her vagina was feeling. And I went, how
Mhm.
have I never even heard of topical estrogen?
Yeah.
How is that not something that we're
Well,
not talking about daily, right? Because, well, I
yeah.
say daily, I'm in my late 30s. Why is
Yeah.
this not something that we're not seeing? You have to know to look for it. You have to know to look to
Mhm.
find people like you, influencers online that sit down and talk to you about it and make it
Mhm.
feel normal. Make it feel like,
Yeah.
wait, am I broken? Why do I need a cream to
Mhm.
feel better? My body should be
Right.
doing this. My body was built to do this. Your
Right.
body wasn't necessarily built to do this,
Right.
right? And
Yeah.
it's
So
okay.
one of the biggest reasons when you're saying, why don't we know this, is because in 2002, the Women's Health Initiative came out and said, estrogen causes cancer. You're going to die. Don't take it. And unfortunately, they were looking at a synthetic form. The research has been completely debunked, but the media went with it and ran with it. And then when the authors came back and they were like, ooh, we misinterpreted this and da 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 da, no
Oh
one
no.
publicized that.
Oh
And
no.
so it was literally in 2018, so 16 years after the original study, that the authors came out and started talking about it, and that new research study started coming out. And it wasn't until November of 2025, so 6 months ago,
Oh my God.
that the FDA changed the label on estrogen to remove the black box warning about cancer and blood clots.
Awesome.
So that's why you haven't heard about it, because everyone has been terrified to prescribe it. Patients have been terrified to get it, thinking they're going to die. And
Oh,
it is one of the biggest life saving medications out there because it reduces recurrent UTIs in postmenopausal women somewhere between 60 and 80%, depending on which research study you show.
shut up.
UTIs in women, well, in anyone, if they get severe enough or often enough,
Will
can kill you.
will kill you. Yeah. Yeah, literally.
So here
You're
we have a natural hormone that our bodies make. So obviously it can't be bad for us because we've had it in our systems for 40 some
correct.
years.
Yeah.
Male, female, everybody has it. Um, and all we have to do is put a little cream there twice a
Mhm.
week. Twice a week at bedtime, a little cream there. Decreases your recurrence of UTIs, improves your vaginal symptoms, improves your urinary symptoms. Like in my opinion, every woman who hits the age of 40 should just be started on it.
Oh my gosh, that is so refreshing to hear.
Yeah.
Her sentiment was the exact same. If you're
Yeah.
if you have any sort of change whatsoever, you should be on
Yeah.
it.
Yeah.
You should start it
Yeah.
sooner
And
than
then
later.
for you, especially because you had changes even earlier, you should have been
Yes.
told to be on it.
Well,
Right.
yes, and like the
Yeah.
symptoms of all the things, like I have recurring UTIs, I have incredible severe itching all the time. No
Hmm.
matter what I do, I have recurring BV because of a IUD that I
Hmm.
had at 30 that they put me on because they thought, well, we can't figure this out, but you can't be on hormonal birth control, so we need localized hormones. I bled for 6 months. I had the worst case BV my doctor had ever seen.
Oh my
3 rounds of
gosh.
antibiotics while I was on it. Another round when I got off, so 4 rounds of antibiotics. I'm fucked up from this
Yeah.
experience, right? And like
Right.
listening to all of this, and now obviously going in July and having a full hysterectomy and all of this
Mhm.
stuff, this is all stuff that I will have to have, right?
Yeah.
Like at post procedure, these are all things I have to have. Now I feel like I finally have the knowledge to start asking the questions. And we don't know
Yes.
what to ask if we don't know, right?
Correct.
And so I think it's super important that we're having these conversations. We're platforming
Hmm.
them for people that are younger, that are in their
Yeah.
30s, about to go through the change. And
Hmm.
I just think it's so important that we have these conversations, male and female, right?
Hmm.
Like, no
Yeah.
matter what genitalia you have, hormonal
Right.
health is health. Without it, we
Yes.
are not a whole human. And it's like,
Absolutely.
there should not be stigma. It shouldn't be embarrassing. We all have them,
Yeah.
just like we all have naked bodies. There just shouldn't be
Hmm.
shame around the body that looks different, a body that works different. It's okay. Sometimes we need a little help, you
Right.
know?
And age, just remember, especially for men, your testosterone can start tanking in your 20s and 30s. For women, I mean, I remember my first perimenopause symptoms started when I was 38 years old. And I was told, you're too young for that. That's not
Yeah.
it's not true. If you are feeling off, you're not feeling yourself, I don't care what your age is, get your hormones checked because there are a lot more factors. I mean, we're kind of focusing on perimenopause and menopause and what we nicely call andropause, even though that's not a real name. But, we're talking about these things right now, but there are so many other phases of life. And especially as reproductive women,
Yes.
whether you've had kids or not, there are different phases we go through with our reproductive hormones that you can be off at any point in time. And so there are things that we can do regardless. Don't let age be the factor. Let your
Yeah.
symptoms be the guidance.
Oh, I love that advice. Don't let age be the factor. Let your symptoms be your guiding light.
Hmm.
That is incredible. And I think that's so important because we aren't really taught to listen to our bodies.
Hmm.
We're taught that it's okay, no pain, no gain. And you're like, you go through
Right.
your life miserable because you think everybody else is doing it. And all of a sudden
Hmm.
you're like, a doctor helps you feel better. And you're like, there's a life that I can actually feel okay in.
Yeah.
What?
Right.
I can actually wake up and not have all these crazy symptoms and not fight for my
Yeah.
life every day. What?
Yep.
Amazing. It is
Yeah.
amazing. I have taken so much of your time this morning. I just so appreciate you. Is there anything else that we should know that is setting your soul on fire right now before we start our naked minute? Um, is there anything else that is setting your soul on fire that you really want to talk about? Is there something coming up that you're excited about? Anything that's going on?
Yeah, I would say I do at least once a month. I host webinars for perimenopause and menopause. We kind of do a deep dive, and they're free. Obviously, I plug my own business at the end of it.
Sure.
So if you're in Maryland, you definitely would want to look me up. But it's very educational. It gives you answers to some of your ideas and your thoughts, and gives you things to ask when you do go, regardless of if you use me. So
Right.
you can find that information on our website too. And like I said, I do them at least once a month. So they're really good if you want more information on specifics.
Awesome. And every week your podcast comes out between the sheets.
Yes.
That
Yep.
is
Between the
Wednesday.
Sheets comes out on Wednesdays because it's
Yep.
hump day and it's a sex podcast. And I just thought that was cheeky and cute.
Absolutely. Mine comes out on Wednesdays too, only because I'm neurodivergent and Mondays are too hard and Friday nobody listens. So hump
Yeah.
day, hump day.
Okay.
um, and this one will be coming out this Wednesday, ironically,
Excellent.
because I do every other week. I do a guest and then I do my own and then a guest and my own. So
Oh, very
it's
nice. I
super
like that
exciting.
pattern.
Yeah, it's really fun. But yes, make sure your podcast is a plethora of information. You just hosted recently. It's a couple that owns a lube company. Uh,
Yes.
and that one was a
Yeah.
really fun episode. And I was like, oh my God, I love that people are on the internet talking about this stuff. I don't know. I'm
Yeah.
just like a smitten kitten. I think it's so great. But your podcast is great. And it is a free resource that you put your heart and soul into, and people need to go listen. So, and then on Instagram and social media, how do people find you? Because you are moving from Between the Sheets to Revive.
Yes. So the handle that
Revive-ish.
you want to follow is Revive-ish. So Revive ISH. Yeah, I thought, it's just too much
It
to
is.
try and have multiple pages and post on multiple things,
Yep.
and it's all
They're the
overlapping
same.
content.
Yep.
Yeah.
They're all the
So yeah,
same.
so we have moved to at Revive-ish. Yeah, so at Revive-ish is the handle. Reviveish.com is the website.
Yep. And it's a beautiful website. You've done a great job with that.
Thank you.
So it tells a lot about who
Thank
you
you.
are and all your values. And obviously, you've got great talking him videos, and like it's very informative. So I very
Thank
much
you.
appreciate a good website. So you've done a great job with that. I'm just so proud that you came on today. I'm so thankful.
I'm so happy to talk to you again. It was so fun when you were on my episode, and now I get to be on yours.
Yay. It's like the best thing ever.
Yeah.
Okay. So, Naked Minute, are you ready?
Okay. I'm ready.
And if something is too personal, just say pass.
Okay.
Okay. What's one thing you've done recently that scared the shit out of you, but you did anyways?
Oh, great question. Open to business.
I was hoping you'd say that.
Yes.
I'm
Opened a
trying.
business and left my full-time job without having enough clients to pay for my bills.
Look, I am the biggest pusher to start your own company. I'm like, just do it, just do it, just do it. And I love when people do. I know it's scary as shit and you're like doing the
It is.
craziest things right now, but I'm so proud of you because I just think it's amazing. I just think it's
Thank you.
amazing. Okay. Sex with the lights on or off?
On.
On. I love that.
Yeah. I
Um,
like to be able to see. Mm.
I do too, because sensuality is the
Mm.
the senses, right? It's play,
Yes.
it's sight, sound, smell,
Hmm.
taste, feeling. It's all five
Yep.
senses is sensuality. And like
Hmm.
without that, it's just sex. It's just fucking, right?
Right.
Like
Right.
it's not a
And there's a
sensuality
place for that
practice.
too.
And there is. I was gonna say there's a place for that, but lights
If,
always the fuck on. Never the big
yeah.
lights, always the soft lights, but lights are always on.
Correct. Yes.
When you pick an outfit that you go out in that makes you feel the hottest, what are you wearing?
Mm. I like to have a dress that shows like, and not super short mini skirt that some of these girls are wearing these days, which good for them, but I don't like to show my asshole.
Fair.
So like mid thigh, kind of fitted, and then I like my arms to show because I like my arms and I like my legs, so that's why I wear a dress.
Cute. I love that so much. What's your favorite thing about your body?
My smile, I think. I went through years of braces and taking teeth out, putting teeth in, all the things, and I think it turned out pretty great.
It is. You have such a good smile. You really do. Okay. And last one, a piece of advice that you would give to your younger self.
Other than not marry my ex-husband.
That's
No,
the
I got kids
pass.
out of that. I got kids out of that. I can't say that. I think if I could go back, it would be to just keep pushing through. I've been through a lot of difficult moments in my life, different relationships and things that were difficult. But I love where I'm at in life now.
Mhm.
And I don't think that had I not gone through everything that I've gone through, that I would appreciate where I'm at right now.
I love
So I
that.
don't think that I would go back and say, don't do this or do more of this or whatever. It would just be like, just keep going because
Yes.
where you're headed is so good.
Oh, I love that. That makes me so happy. That's a good one. That is a good one. And I always say that everything happens for a reason and that you wouldn't be sitting here today. We wouldn't be having this conversation. You wouldn't be impacting the people that you're impacting if anything at all had gone differently.
Yeah.
And so I just think that's wonderful. Just keep pushing through. Ah,
Thanks.
this was so good.
So good to talk to you.
Thank you so much for coming on. Like I said,
Yeah.
your episode airs on Wednesday.
Okay.
And I just can't thank you enough for taking the time today and showing up and being your ray of sunshine self and taking all this time. I know it was supposed to be 35 minutes, but here we are 50 minutes later. We're still, I would talk to you all,
Okay.
I would listen to you all day. So I will
Oh,
link all of your social medias and your website in the show notes.
thank you.
And you can find us on the New Troop. We are both a Substack as well as a YouTube channel. And you can find the episode in both locations. We also are on Spotify and Apple Podcast. So any one of those platforms, you can find us. And I just can't thank you enough for being on today. You're the best.
Thank you for having me.